So these are some of the things what you look out for. So you are looking out for a lump in the breast, when the nipple is pulled in, there's dimpling, then skin changes around the breast, redness and rash around the breast, then dripping. And then dripping is where there's discharge in the breast. And there's a difference between the dripping and then breast milk. So for someone who is breastfeeding or someone who is not breastfeeding, when there's discharge from the breast and it is smelly, it is yellowish, it shows that it could be a possible sign of breast cancer. And then when we look at the lump too, not every lump is cancer. So if someone does an examination and they see the lump in the breast, biopsy is done to further determine whether it's cancerous or not. So that if it's cancerous, treatment is done accordingly. If not, the lump is taken out. That's surgical procedures that are done to take the lump out so that it doesn't get infected to be cancerous. So some complications of breast cancer. These are pictures of some complications, like any wound. Once you get infected and is not treated, the infection spreads to other parts of the breast and it worsens the condition. So these are some of the complications that can arise from breast cancer if it's not detected early. And so this is like an aftermath of a complication where both breasts have been removed. And it's I can say that it's if one gets breast cancer and it doesn't spread to any part of the body. Once the is removed, the person is safe from getting reinfected. So some causes of breast, so identify that as I said, there are hormones. Women have hormones, estrogen hormones, and once these hormones get high in the body, and then they affect the cells. This is how come like breast cancer comes about. So some risk factors of breast cancer, not physically active, like most disease conditions. So not physically active, being overweight or obese, having your first pregnancy after age 30, drinking of alcohol, smoking, having your first child at an older age. Then the factors continues. So getting older, the chances of getting breast cancer increases with age, especially after 50 years, because of the hormonal changes that take place in the body around that time. So personal history of breast cancer or breast conditions, then a family history of breast cancer, because they are hormones. And then when you read further about it, there's a gene that kind of affects when one gets infected. That is how come a family history of breast cancer. So if a mother or it's in the family, it's possible that another family member may have inherited the gene, therefore making the person at risk of getting breast cancer. Being exposed to radiation. If you receive radiation treatment in the chest as a child, it increases your risk of getting breast cancer. Then having your menses before age 12 and menopause after 55 years also increases your risk of getting breast cancer, all because of the hormones involved. So preventive measures. We are creating the awareness because like any disease, we are saying that early detection would increase would make treatments prompt, and then yes, and then would reduce complications. And breast cancer is such that it's not like malaria that you are getting that you feel free. Usually, if you don't do breast self examination to detect the lump early, by the time you start having the severe clinical signs and symptoms, the cancer would have been in the second stage or the third stage, which makes treatment expensive and then it makes mortality high. So we say that The best preventive method is early detection. And how do we detect this early? We detect it early by doing monthly breast examination so that you know your breast very well every month. Then when there's any abnormality at any point, you can quickly say that there's something wrong. Then you go in for treatment. So the preventive measures continued aside the breast self-examination and quitting smoking, regular breastfeeding of children. Then you limit postmenopausal hormone therapy. This one is more in the advanced world than in our world. Then you maintain a healthy weight. And maintaining a healthy weight runs through all illnesses, and then choosing a healthy diet. Then these are some measures that people at high risk of getting breast cancer. For instance, somebody whose grandmother maybe got infected with breast cancer, an auntie, somebody. So such a person is at because I said earlier that a family history of someone having breast cancer makes the person at high risk of getting. So such a person can decide that okay, so since I'm at high risk, I'll start chemotherapy and then preventive surgery. Where if I realize that I'm at high risk, I'll have my breast removed, then I'll not have cancer. But for this also applies mostly education ongoing. Going forward, this may apply to us, but it will apply more to the outside world. But for us, basically it's the breast self examination. And then I'll play a video on how to do the breast self examination so we can see. Pulling your nipple out, you are checking for pain, you are checking for discharge. So step two. So you raise your hands. You raise your hands because the breast tissue is so you are checking for nipples and for discharges or any secretions from the breast. So then the fourth step, you lie on a firm surface and then you palpate the breast in a so this is telling us when to do it and then you take note of it. In order not to forget, you can mark on your calendar. The mammogram. So you can do that every year. So, so as I said, we've seen how to we've used a video to see how to do the breast examination. So just like the video, you stand in front of a mirror, you put one hand at your back. So you stand in front of your mirror or you lie down. So you put one hand at your back at the breast that you are coming to do the examination. You start from your armpits because the breast tissue starts from the axilla. So you start there. So you move in a circular motion. And for the circular motion, you can either go this way or you start from here and then you come this way to your nipple. Then you press your nipple to check for discharges. So you repeat the same procedure. You change your hand to your back. Then you use your other palm. You start like that from down. You come round to the nipple. Then you press. As you don't detect abnormality and quickly panic and say, "Hey, I have breast cancer." No. Once you detect any abnormality, you seek medical help and then the medical help, you